Regarding the cannabis or the what we call marijuana, there are more than 100 compounds uh, that this marijuana contains, and two of these compounds are of medical importance, which are the uh, THC and the CBD, which are now used for uh, as for recreational use and um, medicinal purpose. So among these two, the THC is known to be a famous cannabis high. So while the CBD uh, is not. And these two are of this medical interest, in which the bill, House Bill 180, an act providing compassionate and right of access to medical cannabis and expanding research into its medicinal properties. On this, there are series of clinical trials and studies that have been conducted to prove that the benefits of this cannabis is greater, and some of its benefits would be uh, it is used to alleviate the chronic pain for patients with cancer, and also those patients with debilitating diseases like patients with arthritis, MS, or the multiple sclerosis patients. It reduces painful chronic pains with these patients. And others would be it increases the appetite for patients with illnesses or diseases like inflammatory bowel diseases, and for patients with a down immune system. So, like for example, the patients with AIDS or patients with HIV. Then it also helps ease the nausea and vomiting for the chemotherapeutic drugs for used in patients with cancer, used in patients with AIDS. And others would be um, there are studies conducted way back year 2000, wherein there's also benefit on the decrease of intraocular pressure for patients with glaucoma, and these are also used for seizures in patients with epilepsy, and more. So this cannabis is said to be beneficial for patients with these kinds of illnesses. So, what could be the cons or the disadvantage for this cannabis? One would be the risk of psychosis or the the state of euphoria. So, there will be altered men, the mental concentration, the state of thinking of a person. It could be altered, and other studies have shown also that there is inferior effectiveness of treating of patients with this with the glaucoma. Like there are other available drugs nowadays that is more superior than this cannabis in treating the patients with glaucoma. And others would be the well-known the addiction. So with patients with cannabis, since there is a disadvantage of this addiction. So for me, this bill, the House Bill 180, for as long as the section 6 and section 7 wherein there should be a qualified medical cannabis physician who is there to conduct this, the giving this cannabis to patients, and there should be a qualified medical cannabis patient wherein um, series of rules uh, should be met before this cannabis should be given to this particular patients. And for me, further research or trials, clinical trials should be conducted to further prove that the benefits is greater than the risk of this cannabis.